let's now talk about the micronutrients that are required during preconception period to ensure that we have a healthy pregnancy and a healthy baby at the end. So one of the most important micronutrients during this period is actually folic acid. So folic acid helps in preventing neural tube defects, and it also supports cell growth. So a woman requires around 400 micrograms or 0.4 milligrams of folic acid per day during preconception period. And so you are required to start taking this folic acid 1 month before conception and continue through the first pregnancy, the first trimester. So folic acid significantly reduces the risk of serious birth defects of the brain and also the spinal cords. And here we will be able to prevent conditions such as the spina bifida and anencephaly. Why? Because neural tube develops very early during pregnancy. Actually, 1 month before even a woman realizes that she's pregnant, the neural tube would have closed. And folic acid is required during this period to help in closing that neural tube. So some of the food sources for this include dark green leafy vegetables, liver, we have beans, lentils, citrus fruits, fortified cereals, among others. We also have iron, number 2. Iron, a woman requires around 18 milligrams per day of iron, and this will help in preventing anemia and support oxygen transport, because we don't want a woman to enter into pregnancy with low hemoglobin levels, because it can actually result into miscarriage and negative implications can come as a result of low hemoglobin levels. Thirdly, we also have calcium, and this helps in building strong bones and teeth, and also it supports muscles as well as nerve function. So a woman requires around 1,000 milligrams per day of calcium. Number 4, we have iodine, and iodine is also very important because it supports thyroid function and brain development as well as nervous system development. We all understand that thyroid hormone regulates growth, metabolism, and brain development. So adequate iron is required before conception to help in ensuring a healthy pregnancy as well as optimal fetal development, because severe iron deficiency can lead actually to impaired mental and physical development in children. Number 5, we also require vitamin D. Vitamin D ensures calcium absorption and also bone health as well as immunity. So adequate calcium cannot be absorbed if we don't have vitamin D, and we require around 600 international units per day or 15 micrograms of vitamin D per day. Another micronutrient is zinc, and zinc is actually important because it supports fertility, immunity, as well as cell growth. So you require around 8 milligrams per day of zinc. And then another one is vitamin B12. B12 is essential for red blood cell formation as well as nervous system function as well as DNA synthesis. So we require around 2.4 micrograms per day of vitamin B12. And then we also require omega-3 fatty acids. And this is actually important because it supports brain development as well as eye development of the fetus, as well as supports fertility. So a woman requires around 250 to 500 milligrams per day of omega-3 fatty acids. So next time we'll talk about the importance of preconception care to men before conception. So please share, subscribe, and like so that we can get to learn and advocate for good health